Mrs. You can start with.
Okay. Okay, can everyone hear me?
Can, I can.
Okay, hi, good afternoon, everybody.
Good afternoon. Thank you.
All of you have a good lunch already?
Okay, good evening.
Okay, how are all of you? It's been a while since I last see all of you. Okay, welcome to the Health Talk series today. My name is Ewan, and today with me is Nadia. We are from SGH Community Nursing. So today Health Talk topic will be about living with Parkinson's disease. So before I continue, can I check, right? Anyone knows about Parkinson's disease? Anyone here or heard of Parkinson's disease before?
Yes, I have heard it before.
You heard it before. Anyone else? Okay, so some of us, right, may or may not heard of Parkinson's disease before. So hopefully, right, at the end of our talk, you all will have a better understanding of what is Parkinson's disease. So, right, the content for today. Okay, so we are going to share with you what is Parkinson's disease, causes of Parkinson's disease, signs and symptoms of Parkinson's disease. We're going to share some coping strategies for Parkinson and also Parkinson's disease and mental health. Okay, so what is Parkinson's disease? Okay, Parkinson's disease is actually a progressive neurological disorder. They may present an individual with light shaking, tremors in the finger, hands, lips, or even feet. So, right, what is neurological disorder? Neurological disorder means that it's something to do with our brain. So, right, we will further on discuss about the sign and symptom, which I mentioned, the shaking, all that in the latest slide in a while. So, sharing with you one fact about Parkinson's disease, right, that it has actually become a very common neurological disorder in Singapore. So, it's actually said that every 3 out of 1,000 people aged 50 years old and above in Singapore, right, will have the diagnosis of Parkinson's disease. But however, right, this trending is expected to go higher because of the aging population in Singapore. But the take-home point about Parkinson's disease is, right, it's a slowly progressive disease, meaning say that it is not life-threatening, but however, it's life-altering. So what do I mean by altering? Means that the day when an individual is being diagnosed with Parkinson, he or she will have to start making changes in their life due to the progressive of the disease. So what exactly causes Parkinson's disease? Okay, so Parkinson's disease is actually, right, the result of damaged neurons in our brain. So our brain, right, is actually consists of many different types of neurons, right, that is in charge for different parts of our body. So imagine our brain is a control station, right, and the neurons are a group of army that help us maintain our body. So the neuron that is damaged in our in the brain, right, causing Parkinson is called the dopamine producing neuron. So these dopamines, right, will actually help our body to coordinate movement and also make our movement smooth. So imagine having to lose this group of army. What will happen to our body? We will start to lose the impairment of muscle control, facial expression, and also bodily movement such as walking. So, right, you will realize that Parkinson patient, right, they tend to blink lesser than normal people like you and I. And even if they are watching a comedy, right, they actually find it very difficult to smile also. It's because the lack of dopamine in their brain, right, their movement becomes slower. That's why they take longer times to do things also. Okay, so we are saying about like damage of neuron in the brain, right? But what actually caused the trigger the cause of this neurological damage? Actually, still research now, right? There's no exact cause of the reason why that the neuron cell is being damaged in the brain. But however, right, there's 3 main factors that might contribute to the neuron being damaged in the brain. Example like genetic mutation, exposure to environmental toxic, and lastly, hereditary. But however, right, if you ask me, if my parents or my family have Parkinson's disease, do you think I will have it? Or let's say my siblings have, will my next generation has it? Rest assured, right, that research actually showed that, right, from generation to generation passed down, right, it's actually plays a very small risk percentage of 4 to 6% only. So it's not true that if, let's say, your parents or say your family member has Parkinson, right, you will definitely get it. So this is not true. Okay, so now, right, I'm going to explain and explore more on the signs and symptoms of Parkinson patients with you all. So based on slide, right, you can see that I actually divided the sign and symptom into two groups. One is the motor symptom, one is non-motor symptoms. So motor symptoms, right, is the issue related with all the movement, and non-motor symptoms, right, has nothing to do with the movement, but more to like mood-related issue, thinking and mental problem. Okay, so right, motor symptoms, like I mentioned before, right, is actually something to do with the movement. So based on these photos, right, I'm going to like explore with you 4 very classic presentation of a patient with Parkinson disease. So usually in a Parkinson patient, the very obvious sign and symptom is tremor. So tremors are like involuntary shaking or tremors when at rest. So for example, you and I, when we are at rest, right, our fair hands is like this, right? But for Parkinson patient, right, they will tend to have this involuntary movement where their hands will go like this. This is like uncontrollable, and even if you press it, right, they will still go shaking. So this is also partly because of the dopamine cell being damaged lah. So in them, right, we will usually realize the tremors, right, usually starts from one side of the body first. Then slowly as the disease progress, right, it will then gradually become both sides of the body. So say in the Parkinson patient, right, the tremors, right, will usually occurs when the patient is actually at rest, or when they got very excited about something or agitated about something, right? That's why you will see the tremors got worse. This is a very common sign and symptom, but do note that not all patients with Parkinson's will present with tremors. Okay, second is the muscle stiffness in the neck and leaf. Muscle stiffness, right, means the hard, like very hard tightening of the muscle. So can every one of you, right, actually do this with me? Can you see me? Come, do together with me. Yes. Do you guys find it very easy to do this little movement? But for Parkinson patient, right, it's actually very, very difficult for them because of the rigid muscle, the stiffness muscle. So simple things like getting up from the chair, turning around, or even doing 5-finger movement like this, right, can be very, very difficult for them because of the muscle stiffness. So the third point is slowing down of the movement. So right, for this Parkinson group of Parkinson patient, right, you will realize that it's very hard for them to make movement. So example, right, from bus stop A to bus stop B, right, you and I can maybe spend 5 minutes, then we can reach the other bus stop. But for them, right, because of their loss of impairment and slowing down of the movement, right, it's actually make them very difficult to travel from one place to one place, and they are walking in a very, very slow pace. And lastly, right, is the posture. So you see from the photo, right, this is a very, very classic presentation of a Parkinson patient, right? They will usually arch themselves in front. Yes, and this is because, right, the brain is that the neuron is damaged. It forget to send signal to your body to stand up straight or sit up straight. And that's why they will always present with this kind of posture. And when they have this kind of posture, right, it's actually increase their risk of falling. That's why most of the Parkinson patients, right, when they walk, right, they walk halfway, they will stop. They will have this freezing gait, and then for a while, they will continue to move again. So it's their balancing issue and also their gait issue that's causing them to have high frequency of fall also. Okay, so now I'm going to furthermore explain about non-motor symptoms. So remember just now I said non-motor symptoms has nothing to do with our body movement, but more to like mood related, thinking related, and even mental health issue. So for Parkinson patient, right, most likely they will experience like loss of sense of smell, sleep problem, constipation, depression, daytime sleepiness, hallucination, drop in blood pressure, and even psychosis. But I need everyone to know not all patients with Parkinson will share the same symptom. Individual will not experience all the possible symptoms that I mentioned earlier on, and they will or they will not happen like in a particular order. Means say I will have tremors, then I will have stiffness of the muscle. Some people might have stiffness of the muscle but may not have tremors. So right, every person with Parkinson, right, experience different type of signs and symptoms. So how the symptom affect you, right, it actually depends on your own body also. Okay, so having to say so much, right? How do we know that Parkinson is being diagnosed? How do a doctor actually diagnose an individual with Parkinson? Okay, so if say today, right, suddenly over a period of time, say a week or a month, right, you realize that you start to have a little bit of tremor, like maybe simple things like buttoning your clothes, right, seems difficulty for you, then that's where you will start to think, is this like age-related issue, or maybe do I have early onset of, say, Parkinson disease? So because of the worry, right, usually you all will go and visit a doctor. So maybe the doctor can be a GP, a private doctor, or even a polyclinic doctor. But do note that, right, polyclinic doctor or GP doctor, right, they do not diagnose people with Parkinson disease, but usually the first visit to them, right, will be the evaluation of possible early Parkinson disease. They will look into your example, say you have tremors, they will look into more like why will you have these tremors, why is your muscle stiffness, everything, right? They will try to find out more and to determine, say, whether or not is it Parkinson is the main reason for it, or is there any other possible reason that is causing it to happen. So sometimes it might take them a while, right, to decide whether or not are you is an individual having the early signs and symptoms of Parkinson disease. But however, if you present with individual presents with a very strong sign and symptoms of Parkinson disease, they will then refer you to see a specialist, which we call the neurologist, which this group of doctors are specialized in the nervous system issue. So when your first visit to the neuro doctor, right, the neuro doctor will usually takes a very complete and careful medical history from you just to rule out is there any possible other cause of it. Then they will perform a full physical assessment on you. So full physical assessment will include like examining your facial expression. Remember, I say usually Parkinson patient, right, will find it very hard to make facial expression. They will also look into your tremors, see whether is there any tremors in your face, your hand, your arm, or even your leg. And then they will also try to do different tests to test for the stiffness in your muscle. Lastly, right, they will also check whether or not can you get up from the chair easily, and also your walking pattern, and lastly, the balancing issue. Okay, certain stage, right, doctor was also order some blood tests and urine tests, or even order some brain scan to actually rule out for other neurological condition before they will diagnose a person with Parkinson disease. So usually, right, all these tests, right, will go on during the visit, right, and finally, right, if doctors are there's a clear report of you being diagnosed with Parkinson, then the doctor will tell you that actually you are diagnosed with Parkinson disease. So let's say, right, after all the tests has shown that you are very positive for Parkinson disease, right, it might be a really huge blow to individual because there's a lot of uncertainty in their life. You don't know what exactly will Parkinson disease cause you. So the Parkinson disease, right, a diagnosis of it is actually life-changing. It actually need a long time treatment. So it's like slowly, right, you need to adapt your life, right, to accept the progression of the disease. And eventually, right, even every simple things that you do every day, right, you need to change your way of doing it, right, in order to adapt to the disease progression. Okay, so say, right, because it might be a huge blow, right, so certain people find it very difficult to adapt with Parkinson disease. So we are going to explore a few different coping strategies with y'all so that y'all can cope with Parkinson disease better. So certain strategies are take your medicine, exercise regularly, improve the sleep, make time to relax, and lastly, have a balanced diet. Okay, so always remember the most important coping strategies in Parkinson patient is to take your medicine. Reason being, drug medicine, right, drug treatments is the only way to maintain the symptoms for Parkinson disease. So how does a Parkinson drug works? So remember just now I mentioned, Parkinson is caused by the damage of the dopamine producing neuron. So actually, right, generally the Parkinson medicine helps to increase the amount of dopamine in the brain, and it will act as a dopamine substitute. So it will stimulate the brain where the dopamine needs to work on it. And also it will break down the action of other possible enzymes that will break down the dopamine. So if a person is very compliant with his medicine, right, they will generally help to reduce the muscle rigidity, which is the stiffness, improve the speed and coordination of the movement, and also lessen the tremor. Okay, so when will someone be prescribed as a medicine? So remember, right, the doctor will only prescribe medicine, right, based on the individual symptoms, clinical symptoms show. So the choice of medicine, right, actually vary from one person to another person. So the doctor will also have to look into your existing health issue, what kind of medicine are you on, and also your age. So dosage, right, maybe say patient A will have 1 tablet, but patient B will have half tablet. This one, right, is also depending on the patient age, metabolism, and also his signs and symptoms. Okay, so say today, right, I'm very compliant with my medicine, but how do I know if the medicine works well for me? Yes, it's very, very important to follow up with the doctors that initially diagnosed you with Parkinson's disease, is because usually for some people, right, they find that like first after they take the medicine, right, they manage to tolerate their treatment well and return back to the clinic within the given review date. So this is where, right, the doctor will actually examine you further, see whether or not this medicine is actually working for you. Is there a need to increase or decrease the medicine, or say needs to increase more, like instead of 1 time per day, increase to 2 times per day. Then they will solely monitor your symptoms and advise you accordingly. Okay, exercise regularly. So like I say, right, even though medicine is as important, right, exercise is also very important. It plays a very important part in maintaining Parkinson's disease treatment. Why? It's because, right, exercise play a crucial role in improving the flexibility, balance, and also strength in a Parkinson patient. So patients who actually exercise regularly, right, they will feel themselves having a better physical and also mentally, they will feel much more better, and their quality of life also improve. This exercise also can help to slow down the progression of the disease. So remember I said Parkinson is a slowly progressive disease. So if you realize you exercise more, right, you can actually slow down the rate of the Parkinson disease. There is also like research shown if let's say this person A, right, when they know they got Parkinson disease, or they will start to like, because it's a huge blow to them, then they will give up on their life. They will not take medicine, they will not do anything, they will just lie down there at home every day, right? You'll realize that, right, this group of people, they will tend to have a progression of the disease is even faster than those people who take in the effort to go and exercise. So yes, exercise is very, very important. Okay, so exercise in the early stage, right? So they can, in this group of people, right, like in the early stage, maybe the person already feels some tremors, may have a little bit of slower of the movement, muscle stiffness, and joint pain. But we encourage them to go for exercise is because exercise not only help to maintain the Parkinson symptom, it also can help to boost up like cardiovascular health, such as maintaining your BP, then makes a better mental well-being. Your sugar level can control within optimal level. So it's actually a lot of benefit. So, right, as simple as brisk walking or even raising your hand like this, right, can help you to open up and fight against the gravity. Not only so, right, exercise can also help in sleeping, can also help in your mood and mental health. So there's so many good things about exercising, right? Yes, so it is always good to focus on the reward of the exercise. Even though, right, during the process of exercise, it can be very tough, but think about the good thing after exercise. Keeping your body fit, right, will actually help you to carry on doing the thing that matter a lot to you. Example, right, some people enjoy the work, like a slow stroll with your family members, right? So when you exercise more, right, you can actually continue to do all these things that you enjoy. Okay, so remember I say exercise, right? Usually for Parkinson patient, we focus on these 3 elements: strength, balance, and flexibility. So the kind of exercise that we suggest, right, that can improve these 3 elements are simple Tai Chi, yoga, brisk walking, slow run, or even swimming. But if say, right, you are very active, you want to go for a game of soccer, you want to go for tennis, you want to go for badminton, yes, as long as your health allows you to do it, right, go ahead. You can actually do anything, every exercise that you have, but of course, within one ability to do so. Okay, exercise with more complex symptoms. So what do I mean by complex symptom? So complex symptom usually is at the progressive part, right? The part behind part where the tremor starts to get more, or maybe you really find it very difficult to walk anymore, but this shall not stop you from exercising. So usually for this complex symptom, right, we will push them to do exercise, but this kind of exercise is not like yoga, anything. It's actually focused on the everyday movement and activity that this person has difficulty with. For example, right, as simple as getting up and down from the chair. From a chair. So supported workout, right, will keep a person safe and also in the meanwhile feel confident for the person to continue to do the things that he has difficulty in it. So trying chair-based exercise or holding on to a chair during exercise, right, is also recommended for someone to do at home. But of course, this must be performed in a safe environment. The chair that a person use, right, must be a firm, no wheels, that kind of big wooden stem chair lah. So you might be asking, already at the complex part of my Parkinson disease, why still ask me to exercise? Okay, so 3 things that you need to know lah. Even though you have complex disease, why do we still push you to do exercise? Is because it's good to focus on the everyday movement and activity you have difficulty with. So when you ask yourself to do more, getting up and down the chair more, sooner or later you realize, I can move smoothly already. I will not have the fear of falling down anymore. So it actually boosts out your confidence in doing it. So the right exercise, right, can strengthen the muscle, can increase mobility in the joint, and also maintain general health and fitness. So it's never too late to start exercise. Just push yourself a little bit more, or push someone who you know have Parkinson, encourage them to do exercise. They will benefit more than not exercising. Okay, so now I'm going to pass over to Nadia to further on explain more about the coping strategy. Nadia, please.
Thank you, Ewan, for the very informative sharing. Hi, everyone. How are you guys feeling? Shall we spend a few seconds stretching ourselves? Stretch. Okay, I'm sure you need to do a bit of stretching. Maybe we do a bit of deep breathing. One more time. Okay, are we ready to continue with the second part of the sharing on Parkinson? Okay, everyone good to go? All yes. Right, I'll be sharing on sleeping habit, making time to relax, and lastly will be balanced diet. So these are the various things that we can do to cope with Parkinson disease. So improving sleep, sleep and nighttime problems are very common in Parkinson, and they can affect you at any stage of the condition, and it also can leave you feeling very tired and drowsy. So hence we have a few tips to share with you on how to manage sleep. Maybe you want to share with me how to improve our sleep cycle, or how to make our sleep cycle better. Maybe you want to unmute yourself or type in the chat box. How to improve our sleep cycle such that we have a good good sleep quality? Anyone?
Go to bed at the same time every night.
Wow, fantastic. That's a very good tip. And yes, that's true. So this is what I'll be sharing with you. Tip number 1, having a good sleep hygiene. Creating an internal alarm clock that regulates your sleep. So it means try to have a regular nighttime routine, creating an ideal sleeping environment. So let's say you want to aim for maybe 6 to 7 hours of sleep. So always have a regular sleep schedule. Try to stick by it. Let's say you want to sleep by 9 or 10, so try to have the same routine and the same time. And it's very important to choose your bedtime, meaning to say, right, set the mood. So let's say you want to go bed at night. So you want to go to bed by 9 o'clock, right? So prior to that, meaning you have to slow down your activity, go to the bedroom, switch off the light. You can have your side bed table. If you can dim your lights, even better. Get in the mood of sleeping. You know, like you tell your body, okay, now it's time to sleep. I must be on my bed. I'm ready, dressed up, ready for bed. You know, if you have oil burner, you can burn your oil, relaxing oil. Yeah, so it's very important to have good sleep hygiene. Secondly, tip number 2 is reducing time in bed, being awake. So it means it's not sleeping time. Don't be on your bed. I understand that sometimes you just want to rest, so you go to the bed. So when you rest and you lie down on your bed, you will send signal to your brain saying that, hey, it's time to sleep. Your brain will think that it's time to sleep. So you are on the bed being awake. So this will cause you to become more, your sleep to be more broken, and you'll be more restless, and insomnia can carry on. Hence, it's very important to have a sleeping routine. For instance, you know, okay, you want to sleep at night. So prior to that, maybe 3 to 2 hours before that, you cut down on drinking water. Try not to drink water, like nearing to your bedtime, to reduce from going to the toilet very frequently during the night. Avoid caffeinated drinks before you sleep. Try to switch on relaxing music, you know, cut down on screening time if it's possible. Yeah, so get in the mood of being ready for bed. And tip number 3, leave time to unwind. Try to leave at least an hour to unwind before you go to bed, such as reading a book. Do something that is relaxing and not strenuous. Don't do like strenuous exercise before you go to sleep. So this will get your body very excited. So must start to do activity that tells your body, hey, it's time to relax. Yeah. So, but if you really have serious problem, you are unable to sleep during the night, or your sleep is always broken during the night, and hence it's very important to seek for professional advice. Tell your doctor, write down, it's best to have a record, like how long have this been, and why is find out the triggering factor, why you are always awake in the middle of the night. Is it because you keep going to the toilet, or is it because it's very noisy? Or try to find ways and means to help you to improve your sleep cycle. Okay, the next one is have a balanced diet. Making simple changes to eating and drinking habits can help one manage Parkinson's disease. Maybe, do you know what is the common effect of Parkinson? Let's say with regard to the medication, any of you, do you know? So actually, Parkinson patients, right, over time, with taking the medication, they might have issues with constipation, dehydration. Yeah, so it's very important to have a balanced diet. Eating a balanced diet will improve your health and be help to ease various problems you may be experiencing, including constipation, low mood, reduced bone density, and weight changes. So how do we actually combat constipation? Does anyone here face issues with constipation, or knows or have ever experienced before? How do you deal with it? Maybe you want to share with me? What do you do to help you to pass motion? Yes?
Yes. Drink a lot of plain water.
That's very good. Some more, any more? Apart from drinking water, is there anything else that can help you to pass motion easily?
I take bananas.
Wow, having high fiber fruits, fantastic. Yes, wow, I think you guys can give a thought already. That's true, that's very true. So combat constipation is with diet rich in fiber from sources such as fresh fruits, mainly like banana, papaya, vegetables, whole grains vegetables, whole grain breads and cereals, and drinking plenty of fluids, and exercising also can help you to avoid constipation. Generally, usually elderly don't like to drink water because they say, keep going to the toilet, Missy, which is true. At the start, when you start to drink more water, your body is trying to adjust to the fluid intake. So at the start, you will go toilet for several times, but after a while, then it will be adjusted. So you need to give some time when you make such adjustments. So maybe I may suggest to have a fluid schedule in a day. Let's say you aim for 6 classes a day. This one you need to check with your doctor whether some might be on fluid restriction, so have to be a bit more mindful with regards to this. Check with your doctor what is the appropriate amount of water intake that you can have in a day. So plan your water. Let's say, okay, in the day, morning I target 2 glass, afternoon 2 glass, and then evening maybe by 6 another 2 glass. That's already 6 glasses of water in a day. It's very hard to finish a large amount of water in one sitting. So break up your fluid intake in a day. All right. Okay, next we are going to talk about mental health. How might Parkinson's affect mental health? So you may experience a range of mental health issues alongside with your physical Parkinson's symptoms. Remember, Ewan shared earlier about certain physical symptoms. So apart from that, anxiety and depressions are very common. Usually it's a result from grief at being diagnosed with Parkinson's, from loss of mobility and independence. There are also direct symptoms of chemical changes in the brain that happen with Parkinson. So some people will feel anxiety and depression. This will fluctuate over a period of time during the day and the night, particularly prior to taking the next dose of Parkinson medicine. So it's very important to be aware of the symptoms that they face. Let's say they have this feeling of difference that they never experienced before, sudden feeling of frequent palpitation. Let's say they feel their heart is beating very fast, they feel like they're going to have a heart attack, you're not sure what is this feeling, you feel very sad suddenly, you don't know what is this. Keep a record of whatever you feel and bring it up to your doctor so that we can explore further what is the issue. So how do we maintain emotional health? There's 3 ways that we can look at it. Actually, there are various ways. I'm going to focus on these 3 aspects, like working through feelings, embracing hope, and spirituality. So working through feelings. So how do you work through feelings? So we have a Parkinson support group. Actually, there's various support groups. There's stroke support group, there's Parkinson support group. Within every hospital institution, there is not just limited to SGH, but whichever institution that you are following up with as a patient, as a caregiver, you can ask your medical professional with regards to this. So this is an avenue where a group of people, they can offer to share their experience with those who are on a similar journey. Yeah, this peer support provides opportunity to talk to other people who understand and exactly what you might be going through with Parkinson's, and it's a great way to relieve stress. It can greatly assist in coping and allow you to exchange and get valuable information about Parkinson's and how to live with it. Yeah, so this prevents from isolation. So from there, you can also foster new friendship. The next one is embrace hope. So what is embracing hope? Taking a deep look at positive aspects of your life and nurturing them so that they can grow and change your emotional outlook. So your overall outlook can help reduce stressful feelings. If you try to keep your outlook positive and upbeat, your experience of uncomfortable Parkinson's symptoms will also improve. So it's very important to know what is your trigger. Let's say something upsets you, so try to avoid it, or try to talk it out with your caregiver or someone who's looking after you, or someone who understands you, someone whom you trust. Talk about it. What triggers you a particular time of the day, or more likely of you being stressed. And plan your day, like for instance, to minimize stress. For example, you know you are going out and maybe it's a very stressful process to go to appointment, have to wait for very long for the queue, so many people. So plan your day so that you know, okay, this is the time that I'll be expected to wait, so I need to take bus. So you know what to expect. So in that way, you can cope with the stress. So there are other ways also to cope stress, like meditation, music therapy, light therapy. So explore this with your caregiver or your friends or whoever is staying with you with regards to this, okay? And the next one is spirituality. So focusing on deeper meaning of your life and embracing faith or moral-based core values can offer comfort. Although sometimes includes religion, it doesn't have to, because prayer, meditation and acts of service such as volunteering are some ways people with Parkinson find strength, inner peace, happiness, and a deeper connection to the divine or their community. So actually it's very broad. It doesn't limit to just religion. All right. Okay, the next section is going to be very interesting. It's about myth and fact. I'm sure some of you have heard about people talking about Parkinson, but probably you might not know whether is that actually a myth or a fact. So shall we go through this together? Okay, myth number one. Only elderly gets Parkinson disease. Is it a myth or a fact? Maybe you want to unmute yourself or you want to type down in the chat group. You think only elderly only get Parkinson?
No.
Or younger patients also can get Parkinson?
Yeah. Yes.
Sorry?
Normally, elderly get the disease more, but cannot say the younger will not have it at all.
Miss Christina, very good answer. Okay, let's look at the answer. It's a fact where Parkinson disease can affect adults at any age. Correct, that's true, mainly elderly, but it's actually very common for patients over 60 years old. It can also affect the younger ones too. So one in about 1 in 8 Parkinson's patients are actually under 50 years old. And 1 in 20 Parkinson's patients are actually under 40 years old. So it doesn't limit to just elderly, but it can go up to even younger than 60. All right, let's move on to myth number 2.
Sorry, can you just now can't hear you quite well.
Okay, you want to repeat? Or you want me to repeat about the first myth, is it? Okay,
Yes.
the
No.
myth.
Can you
the
tell me, is
answer-
this inherited?
Is this inherited?
Yeah.
Do you think it's inherited? Just now, Ewan got share, right?
Because I have a friend whose family got Parkinson, so she was inherited. So I don't know whether is this true, that is it inherited or what?
Okay, actually just now I mentioned, right? So actually, right, there's only a small percentage of 4 to 6% that you there's a chance that you might inherit it from your loved one, but most of it, right, there's actually not so much research shown that it's actually like, if let's say your loved one have it, then your family member have it, then you will have it. Yeah.
Okay, thanks. Sorry, just now I missed the first part. Just why I
It's
asked.
okay. It's
Sorry.
okay.
Thank you.
No problem. No problem.
Thanks.
I hope it answers your question. Okay, let's go to myth number 2. All people with Parkinson's disease have tremor. If you see in for the first part, probably you will remember the answer. Do all patients with Parkinson's disease have tremor? Is it a myth or a fact?
Normally, they have.
I like your answer. It's very justified. Yes, that's very true. They have manifestation in different ways. Yeah, but generally most have about 70% patients with Parkinson's, they have tremor. But there are other symptoms which my colleague shared much earlier, like stiff arms and legs, slow movement, problems walking and balancing. So that's why it is very important to be to seek for medical professional advice for their assessment so that they can diagnose you correctly. Okay, let's move on to the third myth. There is no treatment for Parkinson's and it is a terminal illness and fatal. Is it a myth or is it a fact?
It's a fact.
It's a fact?
Yes.
Okay,
There's no cure.
There's no
There's no
cure. Wow, I think you are expert this topic already. It means that you listen quite attentively. Okay, that's actually quite true. There are actually effective treatments and for people with Parkinson, but they can live for more than 20 years after the diagnosis. At the moment, there's no cure for Parkinson, and it do get worse over time, but they can live between 10 to 20 years after they are diagnosed. So medications, regular exercise therapy in some cases, like deep brain stimulation, surgery, case by case basis, can actually help them to control their symptoms. So that's why it is very important to go for your follow-up. Try not to miss your appointment, follow the regime, talk it out to your healthcare professional, to your doctors who are reviewing, have a journal, write down your symptoms. It can be managed and you can actually live a life, a fulfilling life with Parkinson. So with that, we actually have come to the end of the health talk. Thank you so much. We have the next talk coming up next week in Mandarin, the same topic. So I'm sure now is the time for everyone's favorite section, which is the Q&A section. If you have any questions, feel free to unmute yourself or you can chat in the chat group box. One person is limited to 2 questions because we have a very short time. But if let's say you want to ask furthermore in-depth question, you can actually email us at communitynurse@sgh.com, or you can call our hotline and you'll be enrolled by us to ask for more in-depth question. So for now, maybe you can ask for you have some curiosity or some questions that you'd like to ask us. We will try our best to answer to you.
Can I just check? Just now you say, I heard you say surgery. Did I hear you correctly?
That's right. That's right.
So what parts of the body gets operated?
Oh, it's deep brain stimulation surgery. So this one, right, is depending on your condition. So the doctor will assess whether you're fit for this stimulation brain surgery. So, yeah.
I see.
Yes,
and earlier
yes.
on, you say 1 in 40.
For the younger population.
Which age group is that? The statistics.
Okay, 1 in 20 Parkinson's patients who are under 40.
1 in 20?
Parkinson patients.
Singapore, is it Singapore statistics?
Yes, that's right.
Under 1 in 20 under 40?
Yes, correct.
And what about below 60, between 40 to 60?
Okay, for this, right, 1 in 8 patients who are under 50 years old.
1 in 8?
Yeah.
Oh, this is very high.
Yes, that's right.
That's why it has
So
become
it's actually a
most
neurological problem, is it?
Yes. That's why this actually has been a very common neurological disorder in Singapore. It's actually trending high nowadays. Yes.
And would dementia be part of it?
Okay. For one of the side effect, not say side effect, progressively after your Parkinson, right? Certain people will also gradually become what we call by our Parkinson dementia. Yes. So it's actually a progressive thing also.
See.
But doesn't mean you are dementia, then you will have Parkinson.
Yeah, it's usually Parkinson, then progress to dementia, right?
Yes.
Okay, thank you very much.
Anyone
May
else
I
have
ask a question?
Yeah. Yes, please.
These days we always use handphone, things like that, no? Computer. Will it affect our brain, especially the so-called blue light?
Can I answer
Thank you.
this? Hello, I'm Sister Irene. So I just like to answer the blue light. Blue light is more, I think it affects the eyes lah. So that's why they encourage those to have the protection. So sometimes you will see you go to the spectacle shop, then they say, oh, this one will have more protection against computers, the type of rays that can go into the eye. So there's certain things the rays that emit from the either the TV or the screen, you know, that kind of thing. So for this, it affects the eye. So usually you try to limit your screen time, like you don't see so long your phone or your TV. You must have like 20 minutes rest, you know, in between, you know, look far, then look back, you know, that kind of thing. Yeah, and also don't use your phone in the dark area where the room is dark and your phone is very bright. So it causes your not very healthy for your eyes. But as to the ray affecting the brain, there has been advice like you don't sleep, so you don't like put your phone on the phone and then put next on your pillow, that kind of thing. So the advice is actually don't put so near you yeah. And then also
thank you very much.
Yeah, so it there are some rays so you know, for health reasons, you don't, when you sleep, you don't put your phone next to you yeah.
Thank you very much. Thank you.
You're welcome.
Anyone else still have questions for us?
I feel sad addition to all this sharing. If we like people have this disease, really so upset for them.
Yeah. So I think when we are healthy or not healthy, you know, as we grow, it's important to always try our best to keep active and mentally, physically, you know, that kind of thing. Yeah, and always, as Nadia said, be positive. Yeah.
It seems like all the health talk mentioned about exercise.
Yeah.
Yes. Okay, because like I say, right, exercise is really very crucial in maintaining the health. That's why we always say exercise. It's because, right, they not only help you with your flexibility, your body, right? After exercise, right, after you exercise, you can really feel like your brain is freshened up, your mental health, it will get better. Then you will feel that your body is also feeling good. So that's why there's a lot of benefit with exercising. That's why every health talk, right, we will encourage you all to do exercise. Start with small things, like maybe go for a walk, maybe doing some standing exercise. Yeah, it's really, really very helpful.
You don't mind, I share with you. During this COVID-19, thank God, like I started to go to town park and the stadium to walk and jogging. So surprised of myself, actually. Because of the disease, locked down for too long, then become a habit. This year don't go out.
Congratulations.
Thank you very much. I like to listen to your health talk. Yeah, thank you.
There's one question.
At least no more.
Oh, that's good. Very happy to know that. There's one question from Miss Jessie. She mentioned that does putting headphone beside my bed but switch off Wi-Fi and data is okay because you need alarm to wake up. Yeah, I think that's okay as long as you switch off all the data and yeah. I do that too, but not so like not under the pillow I think that's fine.
Yeah, I mean it's practical Yeah, practical. It's okay. Yeah, switch off the Wi-Fi, but then you maintain your alarm clock. That's good. Yeah. Sorry, can I add something? If let's say any one of you, if you have any friends or family with Parkinson and they need support, there's this Parkinson Society as well in Singapore, or you can ask them to approach their neurologist, the neuro doctor who looks after them for their Parkinson, to ask whether got support group in the hospital or not. Like if they are in SGH, there's also a Parkinson support group in SGH. So I'm sure other hospitals also may have. Yeah, but Singapore has a Parkinson Society as well. So yeah, they can you know, go to find support for them in these societies, because there will be other Parkinson patients, you know, who will be there so that they can you know, encourage one another, and also their caregivers. Yeah.
Oh, thank you.
There's a question in the chat.
Okay.
Go cycling.
Never go cycling. But go cycle down injured leg, so cannot go outdoor exercise. But I went to see the doctor. Apply cold compress. Is it okay? Should I go to X-ray? Oh, you haven't gone and see the doctor, Miss Jessie? Oh, turning circle. Oh, okay. So okay. All right. So your question, is it okay if you self-medicate for now by applying cold compress and yoko? Okay, so just observe the swelling. Yeah, whether is it progressively getting better, because our concern when you fall is we are afraid whether you have fracture. Yeah, so observe for the next few days. If the swelling were to subside, the pain definitely will take some time to go. Yeah, if let's say you have a very bad fall, then definitely the pain will be quite intense, and it will take quite a few days for the swelling and the pain to go. But if it's still within the next few days, it still haven't subsided, and the pain it gets intensified, more painful, then I would strongly advise to go and see the doctor, because our concern is fracture. It sounds like you have a bad fall, Miss Jessie. you observe for the next few days. Yeah, if the swelling and the pain gets worse and it's very hard for you to even walk, then it's better to get a professional assessment, because the doctor need to see, yeah, whether is it muscle tear or is it fracture. I see. Okay, that is the second day.
May I ask a question?
Yes.
What is the early sign, very early sign of Parkinson's?
Okay, so early sign may vary from one person to another person, but the very classic one, right, is you will realize that the person might have tremors, very, very mild tremors, and it is not resolving even though you are actually doing, like, if you're not resolved, if you are at rest. Or some people will find that every time they walk, then they will have this like have you guys seen a penguin walk before? So it's like that kind of shuffling gait, right? Then they will realize that every time they walk, they will freeze. Then they will walk again, then they will freeze again. So these are like quite an early sign and symptoms of people who we suspect might have Parkinson. But of course, like I say, right, not all these symptoms is related to Parkinson's disease. They might be because of some other brain-related problem. So if you have, go and see a doctor, get a examination from them. Then they will see whether or not they need to like refer you to see a specialist for it.
If you don't mind, I ask a question.
Yes, please, yes.
Is it good to eat a lot of like chestnut,
Chestnut?
like this nuts, those the so-called what all
Maybe walnut.
nuts, they say
Yeah.
it good. Is it good for our brain?
Oh, walnut, you mean?
Yesterday, I think it's in something like this. Also other nuts, as long as nuts.
Yeah.
Actually, I would not say is everything must eat in moderate lah. So even if the food is a super rich food or super good food, right, you cannot continuously every day you eat, because right, certain food might be good for, say, maybe say carrot is good for your eyes, but if you every day eat, right, it actually will cause harm to your, maybe say skin, you will turn very orangey. So it's the same thing like if you say you eat nuts every day, right, or maybe you have underlying like medical problem, right? So it turns out that maybe you help in your brain, but it actually affect your other medical condition. So we will advise eat things in moderate. Yes, maybe say 1 week you eat twice, or maybe say if you really really love it, then you eat it in a small amount, then as and when lah, but don't eat it every day lah.
Okay.
Yeah,
He
back to my
also.
question on the early signs.
Sorry?
Because just now there was it was intercepted with another question. Early signs of Parkinson's. You mentioned that the tremor is the early sign, because I have a friend. She is a thyroid patient.
Yes.
She also has tremor.
Yes.
So, it's for people with thyroid, it'll be more difficult to detect early signs of Parkinson, correct?
Correct. Okay, so you see, right, because tremors, right, or say muscle stiffness, all these can be because of a lot of reasons. Like you say your friend has thyroid, this could be one of the reasons why they got tremors. But say, right, if for thyroid patient, right, they won't continuously say having this involuntary movement like a Parkinson patient. That's why if say you suspect you having this tremors ongoing or these signs and symptoms, right, that's why we should go for like a first visit to a doctor first, get them assess you. So when they assess you, they will do a lot of testing, assessment, and also if there's a need, they will do scanning, all that to determine, say, is this other brain related issue, or is it some hormone issue, or even Parkinson. Yeah, so there is no definite say I have tremor means I have Parkinson, or I have this means I have Parkinson. It will usually needs a few round of doctor assessment, then they will decide, then they will can finally diagnose you as Parkinson.
I see, good. So involuntary tremor means it's uncontrollable, is it?
Yes. So say, right, this is called like it's not moving, right? For Parkinson patient, involuntary means their hand will keep on doing this. Can you see my hand trembling? Yeah, so this one, and even if they want to stop it, the hand will still shake one. So this one is called involuntary movement, tremors.
So for thyroid patients, is it involuntary too?
For thyroid patient wise, right, I have a few thyroid patient, but it is not say moving, not as in they will stop one. But for Parkinson patient, is that it will be there. Yeah, it will be there.
I see. Okay. So at least can be on the watch out for the longer term. Okay, thank you very much.
Yes. Susan, Miss Susan.
Yeah, from Susan.
Yeah. You raise your hand. Any question?
And what Becky did.
Susan, you did not on your audio sound, so we might need you to actually press the microphone button for you to enable your microphone sound. Otherwise, we are not able to hear you. Alternatively, you can actually type in the chat box so that Ewan or Nadia can actually help to answer your question. Anyway, while waiting for Susan to reply, thank you, Nadia and Ewan, for the comprehensive sharing of Parkinson. I think it's relatively something shocking for all of us, knowing that it's actually a common disease nowadays. Can be found in the elderly or even in adults itself. So we, in view of time, we can take in one last question. So anyone else has any other questions for Ewan or Nadia regarding Parkinson?
Anyone have any more? Last question.
If we do not have any other question, Then once again, thank you, Iwe and Nadia, for the sharing. And like what Nadia has mentioned, so if you have any questions along the way, and we do have something called Ask Missy session, so you can actually drop us at hotline at 65761672 to register for you. Alternatively, those who have actually signed yourself out at the Radimas website on the form.sg, you can actually sign up for Ask Missy session there, and we can have a 30-minute sharing with you on the general information on the questions that you are wish to inquire.
I've checked out the word that I wanted to know just now, psychosis. What is this thing, the non-motor part? What is this psychosis?
Yeah, hi, Miss Cheryl. Okay, nice one.
Sorry,
All right,
sorry.
so
Because just now it was, yeah, I wasn't clear.
okay, so for Parkinson patients, so sometimes over the time due to the disease progression, they might develop certain mental health like mental issues such as psychosis, meaning they hear or see things that is not there. So in order to tackle this, they need to be reviewed and assessed. Then from there, they'll be started on medication to help them manage their psychosis. Yeah,
I
that's
thought
why.
that is hallucinations.
Correct. Psychosis can be different form actually. Yeah, they can hallucinate, they can hear things. Yeah, they can. So it depends on what form they are facing. So that's why it's very important for them to have a journal. So usually for Parkinson patients specifically, either the patient or the caregiver, let's say they are being diagnosed with this condition, we usually advise them to have a diary because they can have various symptoms and we have to tackle one by one. So when they have a diary, then we can take note like at what time, which day of the day. Because in the day they have various symptoms at different time. Yeah, it depends on the medication. So the doctor need to adjust their medication to help them cope with these particular symptoms. One of it, which is psychosis, they might have, but not all the time those Parkinson patients will have this or will have hallucination. It depends, case by case basis.
Or would there be extra suspicious, don't trust people kind?
Possible, yes, that's right. This is one of the symptoms, one of the signs and symptoms also.
Okay, so it's not because of aging.
No, it's not.
Okay.
Usually psychosis is based on they have a certain disease or maybe because of Parkinson is one of it lah. Parkinson can lead to one of these signs and symptoms of psychosis, but it's just one of the mental health that they might pick up along the way. But it's not because of aging that you have psychosis.
Okay, thank you very much. It's been a very fruitful afternoon. Very good.
Oh, very good to know that. I hope all of you have benefited from this talk.
Great.
You guys have been very receptive to the Q&A session.
Sister. Hello, Missy, sister.
Yes.
Can you repeat the first 5 slide again? I missed out.
This one,
Would you be able
right?
to see the YouTube?
Okay, very fast, 1 minute. You have YouTube, man? Where?
At the Facebook of Radima's page, right? You can see the whole entire.
Now you can just play only very fast, 1 minute, 1 second.
No, we don't allow repeats. You can go to the Facebook to watch. We will end the session here. Thank you.
Okay, thank you.
All right, thank you everyone. So for those who
Thank
wish
you,
to
bye-bye.
review the slides that shared by Ewan and Nadia, can actually go to Radima's Facebook page to actually replay the slides again, and the talk itself is actually recorded. And for the previous health talk that you have actually missed out, you can also check out at our Radima's Facebook page. So for next week itself, is actually a Mandarin version on Parkinson. So for those who wish to catch it in the Mandarin version, you can join us on next Monday at 2 p.m. Otherwise, we will see you 2 weeks later for our next health topic in English. Yeah, so that's all for today. Once again, thank you all for your participation, and we will see you. Bye-bye.
Thank you.
Thank you very much, everyone.
Bye-bye.
Bye-bye.
Bye.
Bye-bye.
Bye-bye.
Good job, Nadia. Good job, Ivan.